When a homeless, addicted mother came to me for help getting into drug treatment, I was shocked at how difficult it was to find a place that would take her in. As we reported when I introduced Ashley's story last week, over the years, her addiction cost her her job, her home, and her family. It also cost her her smile. Kelsey Park, a pretty place, unless you have to live there. Homeless and addicted to opioids for 10 years, it's where Ashley spent many a night until she had had enough and reached out to me on Facebook, desperate for treatment to get off the drugs.
Living on the street, running from the sprinklers, running from, scary people, having to sleep at a park and be freezing cold. And I was just done.
At the time, Ashley was sleeping under a pavilion here in Kelsey Park. I made a few calls and got her into a treatment program. About a year later, she contacted me again, this time with good news and bad news.
Hi Liz, it's Ashley. You are the one that got me into treatment 11 months ago. I will be celebrating my year clean next month. I have a question. I'm extremely in need of dental help. Do you know anyone that could possibly help me out?
Ashley's opioid addiction had cost her her teeth, all of them. She'd come so far. What else could I do? I introduced her to Dr. Craig Spodek of Delray Beach.
Before we ever touch her with our hands, we'll be able to do it computerized and make sure that we're going to be placing the implants in a position that will support the teeth, both functionally and aesthetically for her.
Spodek Dental Group offered to create a brand new smile for Ashley, a full mouth restoration with permanent upper and lower dental implants.
I couldn't laugh so hard, or my teeth would come out by laughing.
Ashley could now say goodbye to her ill-fitting dentures, but first, impressions, then surgery.
We have to remove all that tissue, all the hard tissue, the bone and the gums, and remove those old root tips and then push the teeth out.
Holes were drilled into the gum and bone where dental implant metal posts were then placed. After a couple of days to heal, upper and lower bridges were screwed in.
I literally cannot wait to give her that mirror. It's the most transformational thing for me. I can tell you that it's for her, but I know better after 21 years of doing this. This is really for me. The giving is, the getting is in the giving in this case.
And then the big reveal.
Oh my God.
A new woman staring back in the mirror with a new smile and a new lease on life.
You look beautiful. I couldn't be who I wanted to be or laugh the way I want to laugh because of my mouth.
After 10 years of addiction and homelessness, Ashley is drug-free, employed, and mother again to her 2 children. The price was steep, the journey long, but finally, redemption.
I can't explain it. I feel off. It's a dream come true.
Ashley is rebuilding her life slowly but surely. Today, her mind is clear, her heart is full, her faith is strong. She is proof that there's no such thing as a hopeless case. If you need help with addiction, call 211. An operator there will provide you with contacts for agencies that can help. Many of you know I've lived and worked here in this area for most of my professional life, and one of the best parts of my job is working on projects with community organizations and local charities, the kinds of requests we get a lot of here at CBS 12 News. But when a desperate opioid-addicted homeless mom reached out asking for help to get clean, I wasn't sure I knew how to help, but I knew I had to try. It was April 25th, 2018. Hello. My name is Ashley, and I am a victim of the opioid crisis. I went from being a normal single mother,
responsible mother, to literally losing everything, including my kids. Everyone wants to talk about the opioid epidemic. What about the victims like me? Please help.
There were no beds available in local treatment centers, and going to the emergency room wasn't an option. So I called a friend, the mayor of Palm Beach County. She put me in touch with Maureen Killian, who works with addicts and their families.
The problem is traditionally the medical system has never treated addiction. So when kids show up in the ER and they're overdosing, treat them and street them, send them right back out.
Maureen knows the struggle firsthand. Her son has battled addiction for more than a decade, and he recently had a relapse. But drug addicts don't get treated the same way other sick people do.
If this was a chest pain patient, you're going to stabilize and transfer to a heart hospital.
It's called parity. The Federal Mental Health Parity and Addiction Equity Act requires the same level of insurance benefits for mental health and substance use treatment as medical and surgical care. But Maureen says that's not happening.
Because we don't do it, people are dying and people are suffering. Families are being destroyed.
Maureen and her underground network of moms, dads, and doctors found Ashley a bed for detox treatment. But not every addict can contact a journalist who reached out to the mayor, who brought in an advocate, who knew a doctor, who found an available bed. If this woman had been hit by a car, it would have been simple. I would have never heard about it. It wouldn't be a story among thousands just like it, because of lack of parity, lack of beds, and lack of compassion.
People choose to take the drug. That's a fact. They don't choose to become addicted. We, as a society, just think addiction is that homeless person. But I can tell you, we're sitting in the government building, I can tell you there's at least probably 10 people in this very building suffering from addiction, active addiction, right now, and trying to cope.
Chances are, we all know someone who's addicted. In April, Ashley contacted me again. She was out of treatment and clean for almost a year.
My life today is amazing. I have my parents in my life. I have my kids in my life.
No longer sleeping in the park, dodging the sprinklers, and looking for her next hit.
I'm happy today. I'm extremely happy. Everything's going right.
For once.
Yes.
But Ashley is haunted by the 10 years she lost, the homework and games and field trips she missed, the bruises she never soothed, the laughter she didn't share, the tears she wasn't there to dry.
It's just not worth it. Just reach out for help to anybody. You got to be done, or else you're going to die. And I know a lot of people that have died that didn't want to.
So what can we do to fix this? Well, in 2017, former Governor Rick Scott declared a statewide public health emergency for the opioid epidemic, and he was able to quickly allocate $27 million in federal funds for drug treatment and prevention. Maureen says the first step is for Governor Ron DeSantis to do that again. Next is to educate doctors and the healthcare providers, powerful lobbying groups to get beds and programs in place. As for Ashley, this is not the end of her story. The reason she wouldn't go on camera until now. I'll have that for you next week. Jim?